Good afternoon. My name is Brian Howard. I am the town manager for the town of Randolph. Joining me this afternoon is Jerry Cody, the Director of Public Health. We originally were going to do an update tomorrow. However, some things have changed, and we think it's important to get the information as timely as possible to the residents of Randolph. Randolph has been notified that we have our first positive case of COVID-19. At this time, I'm going to ask Jerry Cody to address the public and speak to the process that's followed in these instances.
Very good. Thank you, Mr. Howard. Yes, so Randolph has joined the many other cities and towns in Massachusetts to have a positive COVID-19 resident. So what that means for the town of Randolph is that the Public Health Department is monitoring this resident, and we're making sure that they're following the protocols to remain in isolation so that they don't go out into the community. And the person is recovering at home, is doing well, and there are no children in the public school systems. We understand the individual worked outside of Randolph, did not work in Randolph. And as far as public health protocols, we're checking in, monitoring progress, and we have a public health nurse that's also checking in on the resident to help ensure that they remain well. The quarantine will last through the end of the month, and we'll have constant contact with this resident. Now, as far as any other advice, if you feel as though you are ill, you'd like to remain at home and call your primary care provider to see if you fit the criteria for COVID-19 testing. So the symptoms include fever, cough, or shortness of breath. Now, before visiting your doctor, you are advised to call ahead to let them know about any of those symptoms you may have. Keep in mind there's still a heavy amount of flu. It's still flu season. We still have those type of symptoms. We're also going into the allergy season. So you know your body best. If you feel as though you have any of these above symptoms, you should call your primary care physician to learn more about how you can be tested and remain well. However, if you do have difficulty breathing, shortness of breath, persistent pain in the chest, it's really an upper respiratory pain, or any type of confusion, or they call it bluish lips or bluish face, then you may consider calling 911. But if you do call 911, you would let them know that you're experiencing these symptoms so that we can keep our first responders safe as well. So currently, as you know, there is no vaccine for COVID-19, but we really want to prevent the illness from spreading within the community. So we want you to stay home if you're sick, avoid close contact with people who are sick, and in general, we want you to avoid close contact. We want to practice social distancing. That's at 6 foot. So oftentimes people will ask me, well, why is it 6 feet? And we tell them that we want to remain free of any cough or a sneeze, a distance that a cough or a sneeze may travel. So if you're having trouble thinking about what 6 feet would be, just think about an arm's length. So keep about an arm's length plus to help remain the social distancing rule. So we want to wash our hands with soap and water, and use hand sanitizer if hand washing is not available. And we know why we want to not touch surfaces and then touch your mouth or your lips or your eyes or your nose. That's a way for any of the virus to get into your body. And we want to clean things that are touched frequently, like electronics, our smartphones, our computer terminals, our mice, keyboards, doorknobs, things like that. And of course, cover your cough, your sneeze with tissues or elbow, and immediately wash your hands after that. For more information, the Massachusetts Department of Public Health has put together a 211 number, and you simply call 211, and there'll be a directory, and there'll be a section where you could choose COVID-19. And you'll speak to an operator who will be able to hopefully answer your questions. For further information, you can go to mass.gov, and there's a COVID-19 page, and they'll give daily updates on COVID-19 activity. And for more detailed information, there's www.cdc.gov. We'll continue to provide updates of this rapidly changing situation, and thank you for your attention to this matter.
Thank you, Jerry. So I think that people, the first natural reaction is, well, who's this individual? Who do they know? Who are they friends with? But there are privacy laws and HIPAA laws in place. So there have been cases in all the towns around us. We're releasing the same information that we're allowed to release by law.
We are, and we want to protect the rights of everybody, the individual, and we want to protect the citizens of Randolph. That's a primary concern. We want to protect our first responders as well. So we have staff, the public health nurse and myself and other staff in the office would communicate with the resident and to help them get through this, and it'll help the community get through this as well.
And another component of this process with the state is that a contact list is put together when they speak to the individual. And individuals who may have been in the type of contact which could lead to transmission are then tracked and followed.
That's correct. It's we have a toolkit was provided to us by the Massachusetts Department of Public Health on how to interview those that have either been tested positive for COVID-19 or those who may be a suspect case. And the interview tool is quite extensive. It takes probably about 10 or 15 minutes to at least go over the questions with the person on the phone. And generally we get a real good sense of where they've been and where they haven't been, which is important for us to know to prevent disease transmission.
And I think it's important to note, as we already did, that this individual does not have any children in any school system, whether it's Randolph or not. There's
no. There's no children in any school system, public or private.
I know people tend to want to know that piece of information, so we're getting that out there. So thank you, Jerry. So if you just joined us, Randolph does have its first positive case of COVID-19. The individual is at home now improving and will be remaining at home until the quarantine period ends, which in their case is?
The end of March 30th.
March 30th. Thank you, Jerry. A few other updates. The DPW is just reminding folks that the only items that should be flushed in the toilet is the toilet paper, that wipes and paper towels in particular, even the wipes that say flushable, will in fact cause backups. So we ask the residents to help us keep the sewer system clean and clear. Your assistance is greatly appreciated. I did have an opportunity to have contact with our superintendent of schools, Tia Stavel. Things are going well. They have today, for example, been able to provide over 600 lunches and breakfasts to those in need. Just to reiterate, the four locations for the locations for the schools: Randolph High School at the poolside entrance, the Donovan School at the front entrance, the JFK at the front entrance, and the Lions School at the front entrance. You can pick up between Monday and Friday between 11 a.m. and 12:30 p.m. Another piece of information that I thought was really neat was that over 2,200 students have logged into the system as far as starting to do some of the work online with the educational classrooms, Google Classroom. So things are starting to progress quite nicely within the Randolph Public Schools. So we thank everybody involved, Superintendent Stavel, the teachers, and the parents through this difficult time. Reminding folks, the trash and recycling, no change. Your days, your recycling, everything is the same. We have closed Imagination Station in the school playgrounds, Powers Farm and RHS walking track. As long as there is enough space to continue to have social distancing of 6 feet, we will allow those to remain open at this time. Jerry mentioned it earlier, Mass 211, very important. If you go to mass211.org, or if you just dial 211 from your phone, you can speak directly to the state. They have a lot of information and referrals in multiple languages. We do have information on the website in multiple languages. In addition to that, we have had contact through, I know Councilor Egan had been on Radio Telecompass. I know information has been provided through Vietnamese radio. So we're going to continue to get the word out to multiple partners within the community. The Turner Free Library remains closed and will at least until April 6th. However, if you have items that have been checked out and are due, do not worry about it until that time. You do not have to return them or put them into the box outside of the building. In addition, please go to their website, turnerfreelibrary.org. There is a lot of things you can do with your library card. I've been using it, and I have found it quite helpful. And if you don't have a library card, you can get a temporary library card under the policy page of their website. So if you don't have a card, this is a great opportunity to be able to get one and learn about some of the great things you can do. In particular, as we've mentioned earlier, no senior, nobody with mobility issues will go without. So we have been keeping on top of that. Between 8:30 and 4:30, please call 781-961-0930 if you have any needs. Our veterans agent is continuing to field calls and meet with veterans as necessary. If you need to reach Kevin Cook, please reach out to him at 617-251-7767. Again, this is his cell phone number. That's not a Randolph number. He wants to make sure that he's available 24/7, 617-251-7767. In addition, a lot of residents have started to receive their Census 2020 information in the mail. They want you to do it online. It is the fastest way to do it. It is the most inexpensive way to complete it. People have asked, well, why is this so important? I can't think of anything more important as to why to do it than what we're going through right now. We have a worldwide pandemic. Federal funds are being released. And when they release these federal funds, they often will look at the social demographics of the community. What is the size of the community, the different languages, what are the economics of the community? It is critical that you answer your census. You hear me talk about that at every town council meeting anyway, but now it is that much more clear to me how important and critical it is. There are going to be billions of dollars at stake being released from the federal government because of this pandemic. So please go to my2020census.gov if you've not received a letter and fill out your census. I cannot stress that enough. Please do so. The website continues to be updated every evening, and we change the date so that you know that it has been changed. Town news, go to the main page, please sign up. Same thing. We've been emailing out anytime there's new information. And finally, on the HyperReach, if you go to the town website main page to the left-hand side, click on it, sign up for it. We've had over close to 400 people sign up in just the last 2 weeks. So in addition to the thousands that have done so beforehand. So please sign up so that we can keep you up to date on everything that we can. Finally, to the residents and to the businesses, thank you. This has been a very difficult time, and I think that unfortunately we probably have a number of weeks and possibly months that it's going to continue to be a difficult time. Speaking to a lot of the business owners, they've been touched by so many residents trying to provide assistance to them. to do takeout orders and buy gift cards during this tremendously difficult time for them. In addition to the residents of Randolph, we've had to shut down Town Hall. We do have some limited access that's available. Beginning tomorrow, we're reducing staff even further. We want to continue to keep these staff safe. We want to keep the public safe. We're also doing it to continue to make sure that we have continuation of service, so that if an individual gets sick, they're not in the office at the same time as another individual, so that at this point, we would always have continuous coverage. This is critically important as we move forward into a time frame that is still unknown to us. So if you do call or email the town hall, you will get a response. It may be slightly slower than it was this week, but I can assure you we will always stay in contact with the residents and make sure they have the best information possible. Thank you for tuning in. We will update again if we get any additional information. At a minimum, we'll do at least once a week video update, but we are always going to keep our social media and our website and our emails up to date. Thank you very much. Be well.